This is Dr. Beldholm, and in this video we are going to talk about brachioplasty. Have you ever wondered how a brachioplasty or arm lift surgery works, particularly for post-weight loss patients, and how the different levels of skin and fat is managed? Today I'm going to let you in on those secrets. Now, before we dive into the details, I want you to have a think about this. Have you got loose skin in your arms and chest area? Have you thought about having something done about it? Now, share your thoughts down the bottom. I'm really interested to hear your thoughts about it and comments. Now, stick with me until the end, because I'll also share a critical insight about post-surgical recovery that could impact your long-term result. Brachioplasty, what is it? So brachioplasty is removal of loose skin, generally in the underarm area. Sometimes we do an extended brachioplasty that goes around the bottom of the arm and then across the chest area. Generally it's for my post-weight loss patients, and they have usually several issues with the loose skin. They can have physical discomfort, it can make the clothes fit poorly, they get rashes, rubbing, interferes with exercise. So you may have lost a lot of weight and then you're exercising to maintain that weight loss, but then getting rubbing, rashes, discomfort from that sort of loose skin that's flopping in the underarm area. Now, there are different approaches depending on if you just have skin or if you also have fat in those areas. And that's really important to customize your operation to what the issue is. So during the consult, we'll examine that, I'll measure you, we'll talk about all the possible outcomes from the arm lift surgery. What is brachioplasty or arm lift? So in simple terms, it's removal of skin. So it's a lipectomy of the arm, which means removal of fat and skin from the underarm area. There are many different kinds of brachioplasties. We are looking at a mini, full, extended. And then you can add liposuction with the brachioplasty, or you can leave it without liposuction, and that's an important distinction as well. The mini brachioplasty is really just in the axilla with a little bit of tightening of skin. Very uncommon that I'll do that with my post-weight loss patients because it really doesn't remove much skin. Sometimes if there's a little bit of looseness in the arm and we're doing a liposuction, we can do a mini one to get that little bit of skin tightened. The full one is from elbow down to the axilla, and extended is from down elbow down to axilla and then across the sides. Now there's two types of patients that I see post-weight loss. They are the ones that have lost all the weight and are in their ideal BMI and have very little fat or subcutaneous adipose tissue in the tissues. For those patients, we are basically removing just the skin. Then I have the patients that have lost a lot of weight, have loose hanging skin, but they also have the subcutaneous fat still there, or they might be a little bit in the higher BMI range and have some fat there. So with those patients we do liposuction. There are several different kinds of liposuction that I do, and also with the liposuction that I do, it's not just the arm. Sometimes it empties the arm, but there might be axillary fat, there might be chest fat, there might be back fat that we can do at the same time. If I'm just doing excess skin and fat in the underarm area, generally just standard liposuction is fine. The Vaser doesn't really add much to that operation. However, the Vaser or ultrasonic liposuction, I do tend to like that for the other areas because it gives me more precise control of where I remove the fat from. The Vaser is an ultrasonic or vibrating ultrasound. So you put a probe in, that's a Vaser probe, it melts the fat, you can get really close to the surface, it also heats the tissue, which means that you get a little bit of tightening of the skin as well. So I do like the Vaser liposuction for those properties. I guess the main negative that I see with the Vaser is you do need a little bit of bigger holes to do the Vaser liposuction versus the standard. also it does take a little bit more time to do it. So if you're doing standard liposuction, for example, for half an hour, with Vaser, it's probably going to take you an hour. So for those reasons, I do customize the type of liposuction that I do to each and individual patient. So to summarize, we have the skin only, and then we can do the mini, full, and extended. And then we have, with each of those, we have added Vaser liposuction or added standard liposuction. So that's really important to keep in mind, those differences. Now, the procedure, what to expect. So if we're looking at the mini, then usually it's a day procedure, in and out the same day. It's usually very minimal operation, so an hour or so, and you'll be home the same day. You'll have discomfort for a day or two, but it's not really big discomfort. If we're doing liposuction together with a mini, you will have bruising and swelling through the arm and in the liposuction areas. With the full one, it's a little bit more extensive, so we have a cut from the elbow down to the axilla to remove the skin, so you'll have a dressing. It will take about 3 hours to do. You can stay in hospital, you can go home. A lot of my post-weight loss patients have insurance and private insurance that covers their hospital stay, which means that they can actually stay in hospital and there's no additional cost. If you do stay in hospital, I'll see you the next day and we can decide if you're ready to go or not. With the extended, it does take probably about 4 hours in total, and you can do that with or without liposuction. The extended cut is down the side like that. You will have a compression garment on, so it's a little bit more involved, usually overnight stay. Now, what's the recovery like from a brachioplasty? So the first day, if we're talking mainly on the standard and the extended, you will have quite a lot of swelling. So you'll have a swelling in the hands. A lot of patients feel like they have like two boxing gloves and it's really, really swollen. Lymphatic massage, pushing the fluid out, can help that. All of my patients will wear a compression garment. Sometimes you get a really tightness around that compression garment, and we need to cut that compression garment to release that tightness. You will have discomfort in the arm, there will be swelling, there will be bruising. So that's kind of the first few days. You'll come in, you'll be discharged the following day. You'll come into the clinic for the first 2 weeks. You'll be seeing me and my nurse for those 2 weeks. Usually do light treatment. There's a heel light that we do. We look after your dressing. Generally, we remove the dressing that we put on about 7 days after. All the sutures are absorbable, so we don't need to remove any sutures. The most common issues that we tend to deal with is little wound breakdowns, a little redness, little moist areas, that sort of thing. Dressings waiting for it to heal tends to be the main thing that we do there. The swelling does take about 48 hours is the worst amount of swelling. That's the interstitial swelling that goes in the tissues, and that's when your arm tends to swell up a lot. Sometimes we have to change the compression garment to a bigger one to accommodate that swelling. I usually always recommend lymphatic massage to massage that fluid into the lymph nodes in that stage. For 2 to 4 weeks after. Driving, generally a week, but I will look after you and make sure that you are ready to drive. If you are working from home, you can probably work from first 4 to 7 days, go back to work at home if you're not taking any serious pain medications. If you're just taking anti-inflammatories and Panadol, you should be right to do that. Sometimes typing on a computer can be a little bit difficult because of that swelling that you get in the hands. 2 weeks, generally, you're still going to have a little bit of discomfort, but you'll be able to go back to doing most things, driving, go back to work. Not heavy lifting. Heavy lifting is more towards the 4-week mark. So if you have a job that involves heavy lifting or a lot of driving or a lot of mobility, then you're looking at more 4 weeks. If you're having a work that is just desktop or light duties, then 2 weeks. If you can work from home, then 1 week. So those are kind of the guidelines for that. At 3 months, about 60 to 80% of the swelling will be gone. So that, and then the scar will start maturing. 6 months onwards, you'll find that the redness in the scar will start going, and then towards the 12 months mark, you'll find that it will start fading quite a bit. It's very common to get a few little lumpy areas in the scar and also from the liposuction areas. We'll instruct you on how to do scar massage, but basically any sort of little lumps, you put down, you do a little firm movement, 10 minutes in the morning, 10 minutes at night to just break out that scar for the first few months, and then usually within the next 3 to 6 months it softens up and goes away. Same with the swelling. Again, gentle lymphatic massage is just basically just pulling that fluid up towards the lymph nodes in your axilla. So you gently just massage that area up and the arms up to go towards that area in your lymph nodes to get rid of that fluid. And again, 10 minutes in the morning, 10 minutes at night to get that fluid and that swelling to sort of dissipate as much as possible. Critical factor for successful recovery. As I always tell my patients, the most critical factor in ensuring a successful recovery is patience, and also listening to me and the team, because we will be monitoring your progress to make sure that everything goes the way it should. The body needs time to heal properly, especially after a procedure like a brachioplasty, where both skin and fat has been addressed. It's vital that you follow all the post-operative care instructions, including wearing your compression garment, refraining from strenuous activities until you're cleared by me. Proper aftercare does significantly impact your results. So proper aftercare, making sure we deal with any complications, any issues with infection, get you antibiotics early if you need it, lymphatic massage, scar massage, dressing changes, all that stuff is really, really important to manage you so that you can enjoy a good result at the end. Now, what's the ideal candidates for a brachioplasty? So, most of them are post-weight loss, and it really depends on where the skin is located to which type of brachioplasty we do for you. There is an MBS item number in Australia that is for arm lift surgery, and you have to have a certain criteria for that, like weight loss of 5 BMI. You have to have loose discomfort, rashes that can't be treated with other options. It's always important to know that if you do have significant subcutaneous fat, we use liposuction. If you don't, then we can just do skin only. Skin elasticity is really important. A lot of my post-weight loss patients have lost a lot of skin elasticity. So making sure that we do enough tightness to give you a good result is really important. Not smoking, not taking any medications that will cause bleeding, all really important. So and also having realistic expectations. You will get rid of the loose skin, but you will also have a scar. So the scar fades with time, but it's always going to be there. So you need to make sure that you understand that. And complications happen, individual results vary as well. So we will talk about all those things in your consultation. Now, complications. Complications happen. By far the most common complication or issue that we're dealing with is wound-related stuff. So little breakdowns, moist areas, infections, stitch popping through the wound, raised scar, that sort of thing. That's by far the most common thing that we're dealing with. There are also other things like numbness in the area, chronic pain. You can get a bleed. Hematoma that we have to take you back to operating theater for. You can get a seroma. Now, a seroma is a fluid collection underneath the skin. Anytime we cut anything in the body, we create a space. So that space can fill up with fluids, and then we have to aspirate that fluid, and that's called a seroma. So that's another thing. So there's a number of complications that can happen, and I will go through those in your consultation. Now, Brachioplasty can be life-changing, especially if you struggle with excess skin and fat after weight loss. And whether you're having a mini, full or extended brachioplasty, it's important that you get the correct technique. So adding liposuction if you have fat makes a big difference, but if you don't, it just adds to complications. So if you're considering an arm lift, I encourage you to schedule a consultation so I can discuss your needs in a lot more detail. And together we can create a plan that will help you achieve the most satisfactory outcome. Now, I would love to hear from you. How has excess skin affected your daily life? Put a little comment down. I do read all the comments. I may not answer them, but I do read them all. And I try to make relevant videos for all those comments. So leave a comment. Let's talk. Book a consultation. Thank you for watching. If you're considering a brachioplasty, arm lift, or liposuction for the arms, I'm here to guide you through every step of the way. Don't hesitate to reach out with any questions or concerns, and I look forward to helping you achieve your goals.